Hello everyone, and welcome to Pill to Purpose, your go-to channel where we break down how your medicines really work in a way that's simple and easy to understand. Today, we're diving into a very common but incredibly important medication, levothyroxine. If you or someone you know has a thyroid condition, chances are you've heard of it. We're going to explore what it is, how it helps, the right way to take it, and what side effects you should be aware of. So, let's get started. First things first, what exactly is levothyroxine? In simple terms, it's a man-made version of a hormone called thyroxine, or T4, which is naturally produced by your thyroid gland. Your thyroid is a small butterfly-shaped gland located at the front of your neck, and it's a powerhouse when it comes to regulating your body. When your thyroid doesn't produce enough of this hormone, a condition known as hypothyroidism or an underactive thyroid, that's where levothyroxine steps in. It acts as a replacement, helping to bring your hormone levels back to where they should be. So, how does it work? It's magic in the body. Once you take levothyroxine, it gets absorbed into your bloodstream and travels throughout your body. Your body then converts this T4 into its more active form, T3, as needed. This process effectively replaces the hormone that your own thyroid isn't making enough of. By doing so, it helps restore the normal regulation of your body's metabolism. This is crucial because thyroid hormones influence almost every cell and organ. They control how your body uses energy, maintains your heart rate, regulates your body temperature, and even supports growth and brain development. Think of it as turning the lights back on in a house where the power was running low. Your body gradually returns to a state of normal metabolic balance. Now, let's talk about the specific reasons a doctor might prescribe levothyroxine. The most common use, by far, is for hypothyroidism. This condition can leave you feeling constantly tired, cause unexplained weight gain, dry skin, hair loss, and even lead to feelings of depression or a constant intolerance to cold. Levothyroxine works to reverse these symptoms, helping you feel more like yourself again. It's also used to treat a goiter, which is an enlargement of the thyroid gland. In more serious cases, it plays a vital role in managing certain types of thyroid cancer, often after surgery or radioactive iodine treatment. It's also given to patients who have had their thyroid gland surgically removed. In all these situations, the goal is to maintain the right balance of thyroid hormones in the body, which is often monitored by checking a hormone called TSH, or thyroid stimulating hormones. Getting the most out of this medication means taking it correctly, and the instructions for levothyroxine are quite specific. To ensure your body absorbs it properly, you should take it once a day, usually first thing in the morning on an empty stomach. The ideal time is about 30 to 60 minutes before you have your breakfast or your first cup of coffee. Swallow the tablet with a full glass of water. Now, this next part is really important. Certain supplements and medications can interfere with how your body absorbs levothyroxine. You should avoid taking things like calcium supplements, iron pills, antacids, or even some multivitamins within 4 hours of your dose. They can bind to the medication in your gut and prevent it from being fully absorbed. Consistency is key, so try to take it at the same time every single day, and never ever change your dose or stop taking it without talking to your doctor first. Like any medication, levothyroxine can have side effects. Most of the time, these occur when the dose isn't quite right for you, usually when it's a little too high. It's like turning the body's thermostat up too much. You might experience symptoms of an overactive thyroid, such as headaches, feeling nervous or anxious, shakiness, increased sweating, or trouble sleeping. Some people notice a faster heartbeat, an increased appetite, or even some weight loss. The good news is that these side effects are often temporary and will usually improve or disappear once your doctor adjusts your dosage. This is why regular follow-ups and blood tests are so important. While minor side effects are common during dose adjustments, there are some more serious ones you need to watch out for. These can happen if your dose is significantly too high for a prolonged period. If you experience chest pain, a very fast or irregular heartbeat, shortness of breath, a severe headache that won't go away, or excessive sweating and tremors, you need to contact your doctor or seek medical help immediately. These symptoms could indicate that your heart is under strain, and it's something that needs to be addressed right away. Don't wait for it to get better on its own. Now, is levothyroxine safe for everyone? Not always. There are certain conditions where it needs to be used with caution or might not be suitable at all. For example, people with untreated disorders of the adrenal glands shouldn't start levothyroxine until that issue is resolved. If you have a history of heart disease, high blood pressure, or diabetes, your doctor will need to monitor you very closely, often starting you on a lower dose and increasing it very slowly. It can also affect bone density over the long term. So if you have osteoporosis, this is another factor your doctor will consider. For pregnant women, the need for thyroid hormone often increases. So the dose of levothyroxine usually needs to be adjusted upwards. It's safe and essential to continue treatment during pregnancy, but always under the strict guidance of a healthcare professional. To wrap things up, let's go over some key safety tips to ensure you're using levothyroxine effectively and safely. First, do not skip doses. Consistency is crucial for maintaining stable hormone levels. Second, do not stop taking it on your own, even if you start to feel better. Hypothyroidism is typically a lifelong condition, and the medication is what's keeping you well. Third, make sure you go for your regular blood tests to check your thyroid levels, including TSH, T3, and T4. This is how your doctor knows if your dose is correct. Always inform your doctor and pharmacist about all other medicines you're taking, including over-the-counter drugs and supplements, to avoid interactions. And finally, take exactly the dose prescribed, no more, no less. Levothyroxine is a truly life-changing and highly effective medicine when it's used correctly. It allows millions of people to live normal, healthy lives despite their thyroid condition. If you're taking it and feel like your symptoms aren't improving, or if you're experiencing side effects, don't hesitate to have a conversation with your doctor. They are your best resource for managing your health. Thanks so much for watching. If you found this video helpful and learned something new, please give it a thumbs up and consider subscribing to Pill to Purpose. We're dedicated to bringing you more clear and simple explanations about the medicines that matter to you. See you in the next video.